Hey guys, this is Dr. Ria. I'm really sorry for the mess behind me, but anyways, today we're talking about TCA Cross or TCA peels, which are basically done for acne scars like box scars, ICEPICK scars, anything that's atrophic, anything that has this kind of depression. Before we start and we try to get ourselves completely involved into the science of all of this, you need to understand that I'm not trying to make you a scientist. I don't want you to be a dermatologist either. And a lot of times what happens when you're watching dermats and doctors creating content is you end up getting too much information that you just don't have all the other knowledge required to process that information. So if you want too much of data and science and research papers, I would suggest go and watch Dr. J's videos, who gives a lot of scientifically backed all of that stuff. I'll link a few papers that I've used down below, but again, my content is not to make a scientist out of you, but to make that skincare part of your life a little more easy, understandable, to remove all the complicated shit from it, make it basic, simple, put it into steps that you can follow as a very common person who has no medical knowledge. If you've clicked on this video, obviously you must have heard this from your dermat, or you've already googled a little bit, so you probably know what it is and why people are doing it. So I'd still like to explain it a little more so that there's just no confusion in your head. TCA is trichloroacetic acid. Now you have different percentages of acid, 1%, 10%, 20%, and so on, just the way with any other chemical peels. Alright, now when this acid is used in a higher percentage, say 50 to 100%, what it does is it will cause a deeper level of injury. That injury is controlled by the doctor, and what we're trying to do is we are creating that injury, a controlled injury or destruction of that tissue, and asking your skin or making your skin regenerate over there. So usually when you have acne and there's acne scars left behind, I'm not talking about the hyperpigmentation, I'm talking about structural change, or there's a dip like that, right, in your skin. That is going to be a structural problem. That means the skin in that scar area has changed structurally. So when we create this injury and force your skin to regenerate over there, there's a repair mechanism that happens in wherever there's a structural damage. So basically what we're going to do is we're going to take this high percentage of TCA, apply it wherever you do have those kind of scars, ICEPICK, box, rolling, whatever scars, and let it heal. So there are a few types of scars. Alright, one is atrophic scar, rolling scar, ICEPICK scars. So what is usually done is, what I prefer in my practice is something around 50 to 75%. You're trying to have a controlled injury. Some doctors are very comfortable using 100%, 75%. Now again, depending on what kind of skin it is. For younger people, the skin is a lot more healthy, recovers really well. If the skin is not sensitive, a high percentage is going to be amazing. But I just try to stick to like 50%, because that I feel even if the skin is normal and is really doing well, I can go and use it twice. So this is going to be something that your practitioner gets to decide with their experience and whatever. Alright, now what you do is you take this peel. A lot of doctors are going to use a paintbrush, they're going to use a toothpick, whatever, something very tiny and sharp. They're going to take a little bit of acid. It's going to be very small amount, and just put a point dot over there. That's it. And that dotting thing you have to do all over wherever you do have scars. Totally pains a lot, but it's just for like 10 to 15 seconds, not something that you can't bear. I like to blast the AC on like lower temperatures to make them a little more comfortable, or we just have a hand fan to reduce the amount of pain or burning sensation that is. But again, it's not very intense. It's just something that is very bearable, because you're not doing it on your entire skin. It's just small dots, feels like ants are crawling up on your skin. The dots are going to be small, the pain is going to be bearable, but yes, there will be a burning sensation, there will be pain. What we're doing with this is basically there are cells called fibroblasts. These are the ones that are making new collagen, making your skin heal and all of that. So these are the cells that will come on site and start putting cement and bricks all over again with reepithelialization. Now, how frequently do you do something like this? The frequency and the total number of settings that you will have to do is completely dependent on the kind of scars, the depth of scars, the number of scars that you have, and depending on what are the other treatments that you're combining it with. Usually, I feel like around 3 to 6 sessions will start giving you good results. ICEPICK scars are the worst scars to treat. They're very resistant, they're very difficult to they just don't respond really well. Rolling scars, box scars are amazing scars and they do respond pretty fast. But I find TCA Cross to be the best treatment for ICEPICK scars because the way they respond to this, they don't respond even to lasers like that. It's suitable for all skin types. Who should not do it? Who have active acne? I would say that get your acne under control before you start with these kind of treatment. If you are pregnant, there's not enough data to support all of this. So I feel like just wait. Let your pregnancy get over and then start with your skin treatments. Pre-care. So usually before getting into such intensive treatments for acne scarring or any other skin treatments, I really like to make sure that the patient is on a good skin care routine. Now this is going to have exfoliating acids like AHAs, BHAs, something like retinols. If they're very prone to hyperpigmentation, it's going to be hydroquinone, kojic acid, all of that. So customized skincare routine, but something that helps with the healing. Especially retinoids are amazing because what they do is they help with the recovery when you're doing the treatments. So having your skincare in order is very important. The second is going to be getting, again, a part of all of that, having a good skincare routine is going to be having a good moisturizer, a sunscreen, understanding the importance of sunscreen in especially all of this. Very, very, very important. So we are going to focus on that. We want the skin to be very healthy. We don't want damaged skin barrier and all of that. We want to do this on healthy skin which can react well. If your skin is already damaged, if your skin is already just not in a good state, giving it more injury, healthy skin is the most important thing before getting any chemical peels. Alright, TCA Cross is a chemical peel. What you want to avoid right before the treatment. 3 to 4 days before the treatment, you want to stop using your retinoids. You want to stop chemical peels, AHAs, BHAs, all the actives that can irritate your skin. Just 2 days before you do it, just don't use any of it. Give your skin a break. Care and the post care, absolutely important if you want good recovery and if you want good results. The first one is going to be sunscreen. Because you've actually burnt your skin just a little bit with the peel, you want to make sure that you're not exposing it to harsh sun rays. Sunscreen is going to be very important. Now you want to keep in mind that since it's going to create, first it's going to look red on day 1 and 2, it's going to be a little sore, and later on it starts getting black. Like right now you can see like these are scabs. In the next 2 days these are going to dry, become flaky and fall off. They're going to get crusty and they're going to look dirty and it's going to look very off on my face because it's going to keep getting darker and darker. So you don't want to do this. People have a habit of doing this. Don't scratch it. Don't do this. Don't do this. Don't try to remove it. Don't scrub on it. Don't do anything on it. Let it recover. The next thing is going to be applying a bland moisturizer like the Cetaphil Dab moisturizer, CeraVe moisturizer, just a bland petroleum jelly on that area. It creates this barrier which is going to help with the healing process. You don't want to let it dry off completely, then it becomes more itchy, doesn't heal very well. You want to keep it nice, hydrated and moist. What you want to avoid for the next 4 to 5 days is going to be retinols, AHAs, BHAs. I would suggest just avoid your vitamin C as well, because vitamin C again ends up being a little irritating for people who might have sensitive skin, acne prone skin, and especially when you're doing something like this, I feel like your skin gets sensitized, so avoiding it is a better option. When can you start all of your normal skincare routine again is going to be 4 to 5 days after, once it starts to scab. Get back to your normal skincare routine. Don't be aggressive with it. Don't use very heavy acids and everything. In general, I don't suggest using chemical peels and all of that every single day. Just be gentle with your skin. Here are a few things that can happen that just you need to know. Redness, mild swelling, crusting. The crusting is everybody's going to have this, okay? Hypopigmentation might happen, but it's very, very rare, especially if your practitioner is very skilled. That should not happen. There is a chance of infection, but if the procedure is done right and if you follow whatever post treatment care regime that a doctor has given you, likely that it will not happen. I really love TCA Cross by itself because one, it's very cheap, effective, it takes very less time. The healing process, as much as I've seen it, is pretty good. And for younger girls who have extensive scarring, I feel like this is where you should start rather than any other costlier treatments like lasers, microneedling and all of this. This is where you start. This is something that I have always said, start here, and then whatever next happens is going to be something for when you've done 80 to 90% of recovery with your TCA Cross. That is when you can move to other combination of treatments. Great alternative, but I find the TCA Cross to be extremely effective even by itself. The next step that I would personally add is a retinol, because the combination of a retinol, which helps in skin remodeling, and a TCA Cross, which is making that injury, is just, then we'll just move to doing glycolic acid peels or salicylic acid peels on a more regular frequency. And if somebody wants to just go an extra mile, a TCA peel is such an amazing step to get here. I feel like microneedling and PRP is going to be the last on the list for me, because I feel like microneedling is just too much. Again, the next one is going to be subcision. If you have really big sized scars, subcision is amazing. We'll talk about that in a later video. Just go down, tell me what you want to watch next. We'll talk about that next. Then there's fractional laser, which is also a great treatment. It gets pretty costly now that you're going up on that ladder of treatments, but I would say just start with the TCA Cross. It's easy. There are less chances of complication. The results are going to be really, really great. And I think the affordability of it is something that I really love. With a good skincare and a treatment like this, it's a great place to start. If you've not done anything and you want to start somewhere for those kind of scars, once it scabs, be very careful to not prick and touch it. Look at how this is looking right now. I have put makeup. After the first couple of days, putting makeup is totally fine. Just make sure that you're cleansing properly and you use good quality makeup. This is how these scabs look. They look really red or brown right now. They're going to get crusty and they're going to fall off, and then you can't see anything. Don't get scared if it looks like this. I hope you guys enjoyed the video, and just subscribe to my channel, because now we're going to focus more on creating more long form content, because I realized you guys need it and the short form content is just too boring to make, honestly. This kind of interaction, just being able to provide more in-depth like stuff, I love.